My name is Dean Sukin. I actually grew up in Billings, Montana. I went to Washington University in St. Louis and got a degree in electrical engineering, and then made the decision to transition to medicine. Went to medical school in Chicago Medical School, and fell in love with orthopedic surgery there. And I think the engineering and orthopedics were a perfect mix. I've always been involved in looking at new procedures, new designs of implants, and I think that's really because of that continued interest in engineering. On the hip side, I have been very intrigued with the anterior approach. I was trained in my residency and fellowship to do a posterior lateral approach, and for about the last 11 years I've been doing mostly a direct anterior approach. I saw almost an immediate difference in how fast patients recover, not only when they're in the facility, but over the course of the first couple months. They're way ahead of the patients that have had other approaches. And I think that's allowed us to transition total hips into a surgery center environment, which we've now been doing for a little over 10 years.